Hello, my name is Huma Khan, and I'm a second-year internal medicine resident at Southern Illinois University at Memorial Medical Center. Today we present to you a very interesting case titled, "When is Weight Loss Alarming?" A rare case of Erdheim-Chester disease presenting with leukocytosis and weight loss. We would first like to start off with an introduction. Erdheim-Chester disease is a rare form of non-Langerhans cell histiocytosis that usually presents in the 5th to 7th decade of life. Approximately 500 cases have been reported in the literature since the 1930s. However, in actuality, the incidence of the disease is often difficult to assess due to underdiagnosis as well as misdiagnosis. This disease classically involves the long bones, however, multisystemic organ involvement has also been reported. The case we present to you today involves a 52-year-old male with a 20-pack-year smoking history who presented to his primary care physician for an annual checkup. On physical exam, he's a middle-aged gentleman in no acute apparent distress. Auscultation of heart and lungs was essentially normal. Physical exam overall was unremarkable. Routine labs, including a CBC, was obtained, which revealed an isolated leukocytosis of 13.4 with mildly elevated ferritin level. Peripheral smear showed normocytic normochromic red cells with mild anisocytosis, increased neutrophil count, and a normal lymphocyte count. History was obtained per the patient, and it was revealed that the patient had experienced a significant weight loss of 160 pounds over the last 13 months, and he attributed this to his intermittent fasting and other lifestyle modifications. Given that the patient had an isolated leukocytosis and a significant weight loss, imaging was obtained, including a CT abdomen pelvis with contrast, which revealed symmetric bilateral perinephric soft tissues that, though is a nonspecific finding, it was suggestive of Erdheim-Chester disease, and it was also revealed that the patient had a 3-centimeter renal mass that was concerning for a renal cell carcinoma. Immunohistochemical stains were performed on B11 and B16. B11 lesional cells were positive for S100, CD68, factor 13A, and the BRAF V600E mutation, which was supportive of our diagnosis of Erdheim-Chester disease. The graph at the top shows that the patient's weight loss was carefully reviewed and analyzed, and it was crucial in determining the need for further evaluation. The CT abdomen below shows soft tissue that surrounds both of the kidneys, and it's similar to the CT finding that was seen in our patient. Overall, this case illustrates that Erdheim-Chester disease can often be challenging for providers, as the clinical spectrum can range from asymptomatic tissue infiltration to fulminant multisystemic organ failure. The patient we reported had attributed his weight loss to intermittent fasting. However, careful review of his weight loss trends, as well as a lab abnormality that we otherwise didn't have an explanation for, determined that the massive weight loss exceeded the amount expected by dietary changes alone. It is crucial that significant weight loss warrant closer monitoring with labs and imaging to investigate for an underlying etiology. Early recognition and treatment with steroids, chemotherapy, and advanced immunotherapies such as vimurafenib offers long-term benefits for patients. This patient underwent a nephrectomy and received treatment with steroids, and he is yet to start the immunotherapy treatment. Thank you for listening to our discussion on Erdheim-Chester disease today.